Many women that live with type 1 diabetes are told they can't use HRT, hormone replacement therapy. That's not the full story. And today I want to acknowledge the fear, acknowledge the confusion, to give you clarity, not pressure, if this is something that you are struggling with or have questions about. So what's changed? Well, the old studies versus the current research. Early in 2022, WHI Study, so that's the Women's Health Initiative, this study caused widespread fear. We now know that age matters, timing of taking hormone replacement matters, type of hormones we take really matters. And the risk profile is very different when started in perimenopause or early menopause. So facts play a big part of this decision for women. So the comparison of bioidentical versus outdated protocols, or the synthetic versions in this case. So the older synthetic hormones are not the same as the current bioidentical estradiol and oral micronized progesterone. There's actually a couple different types of ways that you can take and forms of progesterone, but we will just talk basics today as far as hormone therapy in general and the different forms and delivery routes. So today, dosing is more personalized and often lower, much lower than back in the 2002 WHI days. Keeping it simple, it's not the same therapy your mother was prescribed back in the day. And it's really important to understand it's always a risk-benefit approach to anything that we do, especially with our health. And this is an important thing when we're looking at the benefits, the potential benefits that hormone therapy does give us, especially us women with type 1 diabetes. Number one is bone density. So women with T1D already are at a higher risk of fractures. So that's something to be very aware of. And estrogen protects bone density and quality. Another thing is our brains. Estrogen really does protect and support cognitive clarity. So that is a huge benefit. And it may reduce, for many of us, midlife brain fog. So after the age of 40, when things are just not as clear and focused as they once were, estrogen really does play a difference in this. And the number one thing I've seen myself, and almost an immediate response, is how estrogen improves insulin sensitivity. So the utilization of insulin and how it's better utilized in our body. And without a doubt, it lowers our insulin needs, improves our quality of life, and that relationship with diabetes and managing blood sugar. So balanced hormones may support, again, a steadier glucose patterns, improving your time in range, improving your A1C, and reducing your overall insulin needs. Midlife muscle loss increases insulin resistance. So again, the more muscle we have, the more metabolically healthy we are, the less insulin we need. The body just works like a much better oiled machine. And estrogen has a big part of how this operates and really helps to benefit us. Hormone support, like I said, the way estrogen and progesterone work together can help maintain that lean muscle mass. So important. And I just want to emphasize that this isn't just symptom relief. This is metabolic support. So when we get older and the weight loss resistance starts to happen, these hormones can come in and aid that, support that. It's not going to replace it. We still got to do those lifestyle things. We've still got to, eat the protein, lift the weight, stay active, reduce our stress. All of those things play a big role in supporting hormones when you decide to bring them in to your repertoire. So here is what's important if you're considering hormone therapy. Number one is to find a practitioner who understands hormone health and specializes in hormone health, and also a specialist that knows you and knows that you manage type 1 diabetes, that you have insulin adjustments to consider, and how those will and they need to work together when it comes to dosing and how that they formulate a specific hormone therapy regimen for you. And it's also important to go low and slow. This is kind of a cool concept, which I love. So it's about finding that form of hormone therapy, that formula, that type, that delivery method, and starting low. And a lot of practitioners, and I do mention this in my upcoming book, that stacking is really our best option, especially when we're bringing them in the perimenopause stage. So that is starting with one type of hormone, seeing how the body adapts and responds, and then within a couple weeks or even up to a month, at that time, you and your practitioner can decide to bring in the second hormone. So generally speaking, progesterone is the first one prescribed. Again, it's all symptom-based, so whatever symptom is the most pragmatic at that time is what you and your doctor should be looking at to bring in first. And then at that point, you can bring in a second and maybe even a third, being testosterone. So again, these are important things to know and to be aware of. And it's important to let your body adjust, right? And after about 8 to 12 weeks, you and your practitioner, they may rerun tests. Again, if you are through with cycling and running labs and testing your levels makes a difference as far as a marker to gauge as to what you're using, if your body is absorbing it, and all of those factors that determine whether or not this is working for you at this stage of life. Another thing to consider is to track glucose trends. I can't say this enough. It's really, really important because bringing these hormones in, again, the delivery method, the dosing, and all of that is really going to impact glucose. It might be more dramatic for you, or it may not be much of a difference at all. But in theory, it's really important to keep track of those glucose trends like we always have to anyway, especially the fasting glucose numbers. It's important to watch overnight trends and to watch how insulin needs may shift. So again, being aware of your settings, your pump settings, your basal rates, and all of these things, just to see if and when insulin needs to be adjusted, and to do this thoughtfully and carefully with your endocrinologist and your hormone specialist. Hopefully you have a team, a care team that is working together and everybody's on the same page as far as how all of this is working for you specifically. And your provider, just to reiterate, your provider really must understand type 1 diabetes. And if they don't understand how, especially how estrogen and sometimes progesterone can impact insulin sensitivity, it's really important that this is part of the conversation. Don't be afraid to reach out to me if you have any questions about this. I have a lot of resources and specific guides to take with you to the practitioner to help guide your conversation with them. And like I was saying, your hormone practitioner, they really need to know that you live with type 1 and that you do take insulin every day, and how important it is for them to understand that insulin needs may shift. Because the purpose of hormone therapy is to bring this in with confidence and clarity and understanding what it's doing, the benefits it's giving you, and to understand how important glucose tracking is. It's very, very important. The coordination with all of this is so important. You really need to have a balanced perspective. Hormone therapy is not mandatory, it's not reckless, and it's definitely not a one-size-fits-all. It's a decision made with data, tracking those symptoms, and support from a practitioner who knows what they are doing and gets to know you specifically as a woman. And fear-based decisions aren't informed decisions. You deserve full information, not outdated fear. And if you want a deeper step-by-step guide on navigating hormones and insulin needs through every stage, from monthly cycles to menopause, I cover it in my upcoming book, Highs, Lows, and Hormones. This is going to be a survival guide for women with diabetes from monthly cycles to menopause. Can't wait to share that with you soon. And you can grab my free HRT and type 1 diabetes. It's a 5-step guide. You can see the link there. You can download that and stay in my community, because empowerment comes from understanding your options, not shrinking from them.